Good evening to everybody around the world who's been able to join this side meeting of the Statistical Commission here today. And we're very pleased to be able to have a session which will be as interactive as we can possibly make it. And our overall topic, of course, as you know from the title, is how has COVID-19 changed the world for children? And a particular theme running through will be, what is it that we can do and how can we work together to make sure that the issues for children are highlighted so that we can concentrate our efforts on making sure that that children are the least affected and the most helped during these very troubling times. I have two distinguished speakers who will be helping us open this meeting. We have Mr. Omar Abdi, who is our Deputy Executive Director for Programs for UNICEF. And Mr. Abdi has enormous experience from around the world and from around our headquarters, which is a whole different world all of its own. I will invite him to speak, and then I will pass the floor to the Honourable Mercy Kanyuka, who's the Commissioner for Statistics in Malawi. Mr. Abdi, the floor is yours.
Thank you, Mark. Good day, colleagues, friends, partners, wherever you are. Thank you for joining us today. Yesterday, UNICEF, on behalf of COVAX partners, and with the generosity of a number of donors that are committed to equitable sharing of vaccines, COVID vaccines, has delivered the first shipment of COVID vaccines in Ghana. And that is going to begin a rollout of vaccination in countries, in low and middle income countries. A dozen countries will join next week in the south, with those countries in the north that are already vaccinating their health workers. I'm opening our meeting with this good news because we will be discussing, as Mark said, the impact that the pandemic had on children and the role that data and indicators play in shedding light on that adverse impact. So the discussion we will have today will be very critical as many governments now discuss and implement stimulus packages to address the impact that COVID had on the economy and on the people itself. And I think it will be very critical to have evidence and data to make the right decisions for how to target those stimulus. So the timing of the discussion that we will have today is very important. I just want to end, because we have an exciting discussion, by reaffirming our commitment to supporting the statistical commissions and strengthening their capacity to be able to roll out and modernize the work that they do. So thank you, Mark, and back to you.
Thank you so much, Omar, and thank you. And it is indeed a milestone day that the COVAX vaccines are rolling out. And we in the data side are always ready to support and help guide whatever can be done. And thank you. So I turn now with great joy to Mercy Kanyuka, the Commissioner for Statistics in Malawi. UNICEF has been working in Malawi for a long time. We have very exciting and fruitful collaborations in a whole variety of areas. And we're very pleased when Commissioner Kanyuka agreed to make some opening remarks for this session. Thank you.
Good morning, good afternoon, and good evening. Greetings from Malawi, the home heart of Africa. Mr. Omar Abdi, UNICEF Deputy Executive Director, Programs, distinguished delegates, ladies and gentlemen. I am greatly honored to be invited to make opening remarks at this very important side event, which is focusing on how COVID-19 pandemic has changed the world for children. I have been Commissioner of Statistics for 7 years. This is actually my 7th year. And believe me, COVID-19 has changed our routine and the way we do business. Operations in the offices have been disrupted. There's a lot of people have to work from home with very little physical contact. We are also forced to conduct virtual meetings as the one currently going on. Distinguished delegates, with support from the UN and development partners, government of Malawi has managed to regularly conduct the population housing census every 10 years, demographic health surveys, and multiple indicator cluster surveys every 5 years, and then integrated household surveys every 3 years, and many other thematic surveys as per demands from users. The wealth of data and statistical information generated through these exercises have proved invaluable for planning, monitoring, reporting, decision-making processes, and so on. Some examples are that government has managed to regularly review and report on progress in the implementation of the Malawi Growth and Development Strategies, Africa Agenda 2063, Sustainable Development Goals, as well as sectoral policies and plans. Only last year, Malawi made its first voluntary national review presentation to high-level political forum, owing to the availability of current data and statistics. However, COVID-19 has disrupted our ongoing work and progress. One of the biggest areas that has been negatively impacted by the pandemic is how national statistical offices collect data from households and other sources like institutions. We sent enumerators to the field to collect data, and now it's quite challenging due to travel restrictions and safety measures in place to avoid the COVID-19 pandemic. Specifically, these challenges, like last year, they affected the initial NSO teams. They were in the field in April 2020. We had to recall the mixed team from the field. And we also had to recall some 3 other teams which were working on other surveys. We did manage to redeploy the mixed teams, but we did not manage to send the others back up to today. If the situation continues as it is, the country will have to bear not only the cost, but also a complete setback on the data collection gains we've achieved to date. Data collection cannot be suspended indefinitely, as this will jeopardize tracking, evaluating and reporting progress on key national, regional, and global development priorities. Policies too will not be informed by evidence, as governments will find it increasingly difficult to come up with policies that benefit their citizens, including children and women. Allocation of resources to areas that need them most will also be difficult, thus impeding the attainment of the 23rd Agenda and Malawi Vision 2063 for a sustainable and prosperous future for all. With these challenges, we cannot wait until the end of COVID-19 to come back to normality. The vulnerable people, such as women and children, are bearing the brunt of the brutal effects of COVID-19. However, without innovative data generation, it will be difficult to assess the exact socioeconomic impacts of COVID-19 pandemic. As it stands now, collection of data using traditional methods is almost impossible. We need to think outside the box. How do we find innovative solutions to these challenges? Distinguished delegates, I am cognizant of the fact that different countries are facing different challenges in their data collection initiatives since the outbreak of the pandemic. Developed countries are already employing advanced innovative digital and online data collection systems, for instance. These are very underdeveloped and non-existent in many developing countries, including Malawi. I would therefore like to request development partners to assist countries like Malawi, as well as other development countries, in setting up systems that can allow online data collection. In this connection, Malawi is interested to learn more about the Mix Plus to address some of the data generation challenges created by COVID-19. We've heard that other countries have already started using this method to quickly generate useful statistics via using phone-based surveys. With increasing ownership of mobile phones and expanding mobile phone network coverage in Malawi, there's a huge opportunity to use telephones to collect population-based data. Let me also highlight the importance of exploring the potential usage of big data. A lot of data provided by telecommunications companies already exists, which has not been explored. The rapid rise of mobile connectivity, including by the poor masses, leaves a trail of important data with telecommunication companies, which can be used as a starting point for assessment of conditions of children and women. In Malawi, any cell phone number, mobile number, before it can be used, it has to be registered. So at that point, demographic and social indicators can actually be and are being collected, which can provide some insights into the standard of living of these people. There's therefore need to enhance capacity in the NSOs to analyze this data. It is my hope that development partners can assist developing countries like Malawi in the harnessing and analysis of big data to inform various development initiatives. Last but not least, I am a bit concerned, about the current status of the Malawi Social Economic Database, which was supported by DevInfo software. Ever since the developers of DevInfo stopped supporting and maintaining it, there has been no viable solution to replace it. As a result, indicators for women and children can no longer be updated on the platform. May I use this opportunity to request UNICEF to support NSOs, including Malawi, with other alternative, innovative solutions that can assist in the updating of children and other development indicators. A user-friendly, web-based platform. The Deputy Executive Director, I would like once again to thank you and your team for organizing this very important side event. At this juncture, ladies and gentlemen, I wish you all fruitful deliberations on this side event, where we will be discussing the plight of children in these difficult times of the COVID-19 pandemic. I thank you for your attention.
Thank you very much, Madam Commissioner, and thank you both you and Mr. Abdi for those inspiring and very clear opening comments to set the scene for us. And I'm happy to say that one of the side meetings I'll be mentioning later on, Madam Kanyuka, is in fact dealing with data management and display and what to do after DevInfo. So I'm very excited that you raised something. I assure everybody else we didn't fix that. That was something that that very much came as a direct request from Madam Commissioner herself. So thank you all for, thank you both for those opening remarks. And I would like now to share just a few slides to be able to set the scene. The structure of this meeting is that after these slides, we're going to go into what I call a virtual marketplace, which is a set of breakout rooms where each of you can choose which topic you most want to learn more about and have an interactive session with that. And then you'll be able to move to another one and to another one. So there'll be a series of 3. But first, I want to just touch on some of the products and work that we have been doing in UNICEF to be able to help you all to monitor and to track the situation of children, especially in these very tumultuous times. I'll be talking about a brand new, we're launching it today, SDG data portal for the, so it's a portal for everybody to be able to access information about and metadata on and methods for measuring the SDG data related to children. And our COVID-19 data hub, which has a whole variety of resources that I will talk about to use when trying to track what's happening to children because of COVID-19. I will mention a couple of pieces of analytical work. Just as examples, we have pieces of analysis from across the spectrum. And then I'll introduce our virtual marketplace to you. So that's what I'll be doing today. So there are in the order of 35 SDG indicators which are related to children. And so those are ones which UNICEF has a particular interest in tracking and making sure they are available. And we have developed this new data portal, and I'm going to take my life in my hands and hope that this link to the portal live works, which it does, jolly good. So this is the data portal, which you can find from the main page of data.unicef.org, or you can use the link in the presentation we will share afterwards. And it's divided up into identifying the different indicators related to children among the SDGs, allowing you to access country-based SDG information. So there's a summary of progress towards the global targets of the SDGs overall, and then there's a listing of those indicators with the latest values and indicating whether those show that the country is on track to achieving the global target by 2030 or not. In the goal by goal information, you can go through to any of the goals, and my mouse is playing up. There we go. And within the goal area, the indicators related to children are highlighted. And if you click on those, then there's a whole panoply of information about why this indicator is being measured, how it is defined, what concepts are important in understanding that indicator, the computational method, and any other comments. So there's a whole breadth of information about these indicators to do with children, not just the 19 indicators for which UNICEF is a custodian or joint custodian, but across the board on indicators which are important in the lives of children. So, so that is the SDG data portal, and you get to there, data.unicef.org/SDGs. In addition, of course, all of us, we were faced with this terrible situation of COVID-19, terrible in and of itself, and terrible for us data people because the normal means of collecting data were interrupted. So we set up a data and analytical hub also on our data.unicef.org website, and there's a red button on the top you can click to get straight to this portal. And it's looking at the different kinds of data and analytical work that are available or that we've made available to be able to help understand the situation of children, from situation data before the crisis to form a baseline for looking at what needs to be done, for different ways of tracking the impacts of COVID-19 on children, because the impacts are primarily socio-economic due to interruption of services, due to increase of poverty of different kinds. And a survey that we were undertaking through our country offices to try and get a handle on the level of interruption of services and the reasons that services were interrupted. So again, a wealth of data and information available there for you all to use. And data without use are data that really we shouldn't have been collecting in the first place, in our opinion. But we were faced with this enormous challenge last year that the most rigorous and reliable sources of data and statistics in particular were interrupted. So face-to-face household surveys were interrupted, face-to-face work on censuses was interrupted, and many administrative data systems were interrupted. So those usual bedrocks on which we stand were disturbed and interrupted. So we had to resort to less dependable but more up-to-date sources of data, which presents all of us statisticians with real challenges on making sure that the data are not overstated in how strong they are and how useful they are, but that there is something available which is reliable enough to be able to make the kinds of decisions and resource allocations that there are. So looking, for example, we looked at service interruptions and we found that the main reason that health services were not being used was not a supply problem. It wasn't that the health services had reoriented their resources to curative services for COVID. The main reason people were not going was a mixture of fear and reluctance to take a well child to a clinic in case they might find somebody with COVID there. and interruption to services, transportation services, and so on. So once you know the reasons for the interruptions, then you can target your work to be able to help remedy those situations straight away. And then we started looking at different kinds of analysis. I have two examples here, actually related examples, but there's a whole breadth of analysis that we've supported or been partnering with and taking part in. Looking to see how services are interrupted, in this case, case management and home visits for children and women at risk of abuse. And also looking at the mitigation measures that countries have put in place, and what is it that has been done, also highlighting what can be done and what challenges there are to that work. This is an example of violence. There are examples across the whole spectrum of indicators and issues to do with children. So it is really just to give you a little taster of the kinds of work that has been going on. It was an extraordinarily busy year, but necessarily so because of all that was going on. And what I want to do now is to do perhaps the most experimental part of this side session, which is to invite you to join one of these 7 groups, and then after 20 minutes to move to another, and after 20 minutes to move to a third one. So, sorry, for you to pick these topics in order of urgency and importance for you to join. We will record these sessions so that if there's information you feel you would like from a session you don't have time to go to, the recording of that session will be available on the website after after we've uploaded it all. But we have these 7 topics that we invite you to join in. They should be smaller groups, and we should be able to have a bit of discussion on each of these topics. So the first group that I'm mentioning is the impact of COVID-19 on poverty and gender. And that will be looking at the baseline estimate of child poverty and the simulation and projections of COVID impact on it. And special issues related to gender equality and their impact on child poverty estimates is also going to be part of that session. The second one is concerning digital connectivity at home, linking this to, of course, the school closures and the necessity for remote learning in many cases. But what kind of remote learning is possible? Well, it depends on what kind of digital connectivity there is in the home. And so that session will be looking at that. The third is looking at the impact of COVID-19 on violence against children, in particular looking at ethical and methodological challenges affecting data collection on violence against children. The fourth section is looking at monitoring WASH in schools with a special focus on COVID-19, but of course, because of course one of the necessities for schools being open in a time of COVID-19 is to be able to have hand washing facilities available and the appropriate hygienic practices in place. Let me see, sixth session is innovative data monitoring. No, it's the fifth session, innovative data monitoring of child nutrition in times of COVID-19. Showcasing a range of innovative strategies used by countries to collect data when the COVID crisis hit last year. The sixth element is community tools for data. Actually, the Commissioner was mentioning what happens after DevInfo. So there are tools that we have developed and we have piloted with some countries to be able to manage data, to be able to keep them in a structured database, which is SDMX compatible, which is web-based, which links to websites easily and so on. And the final session is an open session, it's a listening session. What do you most need from UNICEF?